Talk about the sauce.
Ooh, Zach sauce.
Zach sauce.
Zach sauce. Zach sauce.
The sauce is boss.
Here's a hint. It's the sauce. Zaxby's new signature sandwich with Zax sauce or new spicy Zax sauce. Only at Zaxby's.
We are enjoying a beautiful spring day out here on our porch with Dr. Shawn Jones from Chattanooga Wellness. Good to see you.
It's great to see you always, Julie.
This weather makes everybody want to get up and get out and be active.
Oh,
For
it's
some
beautiful.
people watching,
Beautiful.
if you're a diabetic, that might be a challenge for you. Neuropathy is a real problem, and
That's
that's
right.
what you wanted to address this morning.
Yeah, we have the most successful neuropathy treatment program anywhere. And I'll stand by that because we get a high success rate, about 98, 95% success rate, right in that range.
How are you grading that, Shawn?
Yeah, what happens with neuropathy and diabetes is the number 3 cause now. The number 1 cause is actually chemotherapy. Now, isn't that a kick in the head? You survived cancer, now you got neuropathy. What are you going to do? You call Chattanooga Wellness Centers. Second most common cause is post-surgery, lumbar or knee surgery. And after that, a lot of times it will affect the nerves in the feet. And so what we do is we evaluate you when you come in. It's only $49 for the full evaluation, consultation, and we do your first treatment free. We go through and do a full neuropathy treatment, in-office treatment of what it's like in the office. And so in the evaluation, what we find out is how severe is the problem. And it depends. If it's less than 25% loss, we just do some laser treatments. Here's a little laser here. Woo. So we laser. This is not the K laser. This is a lot cheaper.
Okay.
We use a $30,000 laser on your feet and on your low back where the nerves exit the spine, and that starts the tissues to heal.
Okay, so let's say that you've had a knee surgery, whether it's a knee replacement surgery or just something, arthroscopic surgery, you name it. And you're saying that it's common that people can then feel a loss of feeling along their legs and in their feet?
Yeah, I guess I should tell. What is neuropathy? Well, usually you feel, it can vary, but usually you have burning, tingling, numbness, spongy feeling, a loss of sensation and balance. You just can't tell where your feet are. And that's the problem. As it progresses, you can fall and break bones and cause other damage to your body in all kinds of places. We don't want that. So our first goal is to get your balance back.
Okay, what if you're somebody who you're listening to you talk and you go, oh, wait, that's what happened to me 2 years ago. I never knew.
Yeah.
Is there a lifetime warranty on how long you can use this laser to your benefit?
You know, that's a great question. What we do is if it's severe enough, we actually send equipment home with you. We spend almost $2,000 on equipment you take home as part of the package if you decide to move forwards with the neuropathy treatment. And it depends how severe it is. But we like you to treat yourself twice a day. One piece of equipment is called a rebuilder, developed by Cancer Centers of America, because they knew that chemotherapy would cause neuropathy. They take proactive steps to try to prevent it and treat you while you're going through, for neuropathy, while you're going through chemotherapy.
So you're saying that if somebody comes in and maybe you kind of judge them and grade them first, evaluate them.
We do a full examination to see how much we have 8 different sensations we check, and you judge us. You tell us how much sensation is compared to your arm, and we see how much difference there is, and that tells us how much loss you have and what treatment program is appropriate.
So if you go with the at-home treatment, is there a limit on how often you can use it? I mean, could you use it multiple times a day and it wouldn't hurt you?
What happens is you still come in office too for 90 days.
Okay.
And what we want to do is treat you twice a week at first, and eventually as you're doing better, we go down to once a week on in-office treatment. And at home, what you're doing is using the rebuilder to stimulate the nerves to grow again, to function again. And we also give a red light therapy that you wrap around your feet, an LED light that helps to heal the tissue. Now, all laser does 4 things, right? Decreases pain, decreases swelling, and it speeds tissue healing exponentially faster. But it makes everything heal so well.
And how? I mean, I know you can't send us to school in a 7-minute segment, but how does that laser do that?
Well, what happens when you turn a laser on and you're running laser on your body, it makes the mitochondria of your cells supercharged. So normally the mitochondria is your Krebs cycle, and it creates ATP. And so what happens when laser hits it, adenosine triphosphate, that's basically the burning blocks for your body.
Okay.
That's what your body does for the whole cellular respiration. And when laser hits it, it goes exponentially faster. And cool thing is, it keeps working for 6 to 8 hours after we're done. You keep getting more, the laser keeps working. So don't put any ice on the area we use laser on for 6 to 8 hours after each treatment. It'll continue working.
Is the laser therapy something that once upon a time, years ago, we utilized not knowing it was a laser, or is this really a novel technology?
Yeah, it's been around for 40 years, and they found that as they started checking stuff, what it does is it increases nitrous oxide in the tissues. So red light therapy increases nitrous oxide, and one of the causes of neuropathy is a decrease of nitrous oxide. Now, this is just the one I use to reset weak muscles, and I go through and check the muscles on you, and I reset them on you with a little pocket laser.
So is it a little bit like the fountain of youth in a way, Shawn?
Man, I tell you, it really kind of is, and it's fantastic. I love seeing people get better, and neuropathy, you don't have to suffer with it. We have lots of people. You see some pictures going on as we're talking about different patients that have they've got 97%, 95% of their feeling back and their pain gone. It's amazing to watch people get better. But there are those people that don't want to do treatment at home.
I'm not trying to make you take this where it cannot go. But when I said, is it kind of like the fountain of youth? You know, as you age, that's the whole nature of it, right? Your cells just don't function the way they did when you're a 10-year-old kid. So does this ability to make them go faster and the ATP and whatever you're talking about, if you've got arthritic problems, can it be beneficial?
Oh, yeah, because if it's a knee replacement that's causing the neuropathy, we're going to laser the knee as well as the feet. If it's not a knee replacement, we laser the low back nerves, because you want to do where the nerves originate in the low back, and also the knee where they might be interfered with, and then of course in the feet. We do all of that. Plus we do vibration therapy. We do chiropractic care, at least on your feet. And if you don't have a problem that stops us from doing the back, we want to make sure we do the low back or full spine.
What is the vibration therapy?
Vibration, you just stand on our vibrate. We have several units at both our offices in Cleveland and Chattanooga, and it stimulates your proprioception. It helps with balance. It also makes the feet feel better. It stimulates blood flow. It's just a win-win. You always do better on your joints also loosen up too when you're on vibration therapy.
Is all neuropathy in your leg, or can you experience it other places?
You can get it in your arms too. And some people we have to do double treatment on. We have to treat their hands, feet, and their neck and low back in order to get them well. Whatever it takes, we're going to bend over backwards to get people well. And here's the coolest thing. When you finish a neuropathy program in our office, you can come in the rest of your life for just $60. You get the adjustment, you get the laser treatment, you get vibration therapy, and even the massage chair, all for $60. Visit the rest of your life to keep you running good the rest of your life if you need it.
Okay, so a lot of what you're saying, though, is going to be patient-driven, right? They're going to have to use the neuropathy equipment at home.
If they're bad enough to need that, yes, they do.
But a lot of people aren't going to do that.
Yeah, I mentioned that earlier. Thank you for bringing that up. When somebody's not going to follow, they say, look, doc, I can come in for some laser treatment here, but I'm not going to do this home treatment. Some people are like that. It's your choice in life. That's okay. Then like last segment, we talked about regenerative cell therapy, using stem cell therapy. So we can go in with regenerative cell therapy and just do fetal cell injections into the feet and let them heal using that. And that works tremendously as well. The cool thing is 90% of our patients never have to go that far. Our treatment program works so well. They don't need to do the regenerative cell therapy for neuropathy. But if you're not going to do the program the way we want it done, let's just jump ahead and do regenerative cell therapy and get you well that way.
I'm a literal person, so you're going to have to forgive me, but you said something about you come into the office for 90 days. You mentioned twice a week and then once a week. Do you mean over a 90-day period?
Yeah.
Okay.
For over a 90-day period. Thanks for clarifying. Okay. Over a 90-day period, and we're in a group called Blueprint that's around the country of doctors that share knowledge. Most of them only see you once a week. I like to see you twice a week, at least the first 3, 4, 5 weeks. And then maybe if you're doing good enough, I'll cut you down. Otherwise, I'm going to keep it twice a week. We don't charge extra for that. It's based upon you and what your needs are, and make sure we get you well.
I'm
That's
putting you
key.
on the spot. And so if the answer is no, we can't help with that, then say no, we can't help with that. But David and I were having a conversation earlier about the pollen count being so high.
Yeah.
Do you see a lot of patients coming in with pollen?
And I tell you, there's things called drainage formulas. We carry them from Standard Process. There's Albizia, there's Antrinix, there's Allerplex. When you take this, it's different. It's not an antihistamine. It pulls mucus out of your sinus cavities, dumps it through the lymphatic glands into your colon, and it just comes out with the bowel movements. And so you take it, within 3 or 4 minutes, you go, wow, my ear just opened up. You don't have any side effects. There's no
And what is that
problem.
called?
Antrinix. There's several products. If you come in our office, there's Allerplex, Antrinix, Albizia is an herbal blend.
Is it a naturally occurring thing?
Yeah, I don't know how he figured it out, but it's actually organically raised cow liver enzymes that are
cow liver enzymes.
Yeah, and when you take these, Antrinix is cow liver enzymes. When you take it, it just pulls mucus right out of your body. Now, if somebody's a hardcore Adventist and they're just not going to take any animal byproduct at all, we can use Albizia, which is herbal. Herbals always cost a little more.
Right.
But they're very effective. And I'm taking a little Albizia, too, to keep my throat clear with patients right now. And I don't have too much problem, but I noticed that my head gets stuffed up at nighttime when I'm
Right.
sleeping. I can feel it drain to one side.
So it's kind of like pick a topic, any topic, and he can talk to you about it and see if he can find something in the office there at Chattanooga Wellness
We're a
that can
full
help
wellness
you.
center. Yeah, absolutely.
So for this particular conversation, though, about neuropathy, he tries to make it as easy as possible for you to go online.
That's right.
And find out what it is that you're looking for within his services. So the website you see there on your screen, even though it doesn't mention Chattanooga Wellness in the website, it's just the fastest way to get you to this
So those
information.
pages that show about laser and neuropathy treatment.
Great to see you this morning, Shawn.
Thank you for having me. We have locations both in Cleveland, right by Tennova Hospital, in Chattanooga, East Brainerd Road, at Brainerd Road. Come by for $49. You can see if you have to suffer no longer. You should not. You should respond well. Oh, 790-5000, by the way.
James, your car was pulling to the right, and you came